me a big ah.
Now. Left. Cold. Cold. 2. Sharp. Dull.
Hi, Skylar. My name is Dr. Matt. I'm going to do your exam today. How are you feeling?
Oh, I'm feeling all right.
I have here a new file for you, so we're going to go ahead and just verify some information that we have from your previous doctor. Okay. Can you please verify your last name?
It's Ashland.
And your date of birth, Mrs. Ashland?
It's January 14th, 2000.
Okay. Do you have any allergies?
No.
Are you taking any medicine on a daily basis?
No.
And when was your last checkup?
It was 6 months ago.
Okay. Anything in particular that you would like to address today?
I'm having some numbness in my back and also some vision changes.
Okay. For how long have you been having the vision changes?
The past month or so.
Are you experiencing any blurriness?
Yes.
Is it in both eyes or just one side?
It's in both.
Okay. You said 1 month. Does it come and go or is it constant?
It comes and it goes.
Okay. Have you noticed any floaters or any dark spots in your vision?
No.
Okay. Do you wear contacts?
Yes.
When was your last vision checkup?
It was 3 months ago.
And anything in particular at that exam that you recall?
Just the same.
Okay. Okay, tell me a little bit more about your back pain. For how long has it been going on?
Sure. So I started noticing it maybe a month or 2 ago.
Okay. And is it constant or it comes and goes?
It's constant.
Constant. On a scale of 0 to 10, how would you rate your pain?
Maybe a 6.
6, okay. Are you taking any medicine to manage your pain?
Just a Tylenol.
Okay. And does that work for you?
It helps, but I still need some help.
Okay. All right. Have you noticed any numbness or tingling sensations in your fingertips or your toes?
Oh, yes, I have.
Okay. In your toes or your fingertips or both?
Both.
Both. On both sides or one side?
On both.
Both sides. Okay. And has that been going on in the same time with the back pain?
Mm-hmm.
Any car accidents that you remember?
Yes.
When did that happen?
Oh, it was 3 months ago.
Okay. And were you hospitalized?
No.
Any broken bones or any major injuries from the accident?
Just a fender bender.
Do you remember hurting your head or losing consciousness?
No.
Okay. So I'm glad that you came in for this checkup. We're going to do a full body head to toe exam to make sure that we're not missing any symptoms. And we're going to start with vital signs. going to go on your upper arm. Okay, go ahead and relax your arm. Okay, this is going to go here. You're going to feel kind of like a squeeze. Any hypertension in the family?
No.
I'm going to put this on your finger. I'm going to check your oxygen and your heart rate. I'm just going to slide this down. I'm going to take your temperature. 99.5. That is a little bit high. Have you had any flu-like symptoms? Okay. Oxygenation is 98% under the air, and heart rate is 80. That's normal, but blood pressure was a little bit borderline. I would say it was 138/65. Okay, I'm going to check your mouth. So I'm going to see if there is any signs of redness or infection, something that would explain maybe the slight low-grade fever. Give me a big Okay. So I'm not noticing any white spots. Doesn't seem like it could be strep. Okay. I'm going to check your vision since this is one of the major concerns that you've been having. So you notice that you're seeing a little bit of blurriness. Is that far away or close up?
Far away.
Far away, okay. Go ahead and look straight in at my nose. I'm going to flash a light in your eyes. Good. Okay, pupils are round and reactive to light and accommodating. I'm going to go ahead and just slowly press down on your eyelid and check if there is any yellowish discoloration. Look up. Okay. Look up. Good. Look right here. Okay. I'm going to bring my fingers into your field of vision. Go ahead and tell me when you start seeing it, okay? I'm gonna have you cover your right eye first with your right hand. Perfect. Go ahead and tell me when you see my fingers in your field of vision.
Now.
Okay.
Now. Now.
Okay. Let's go ahead and switch eyes.
Now. Now. Now.
Okay. So there's a little bit of peripheral vision loss as well. Let's go ahead and do that one more time. I'm going to have you cover your right eye. And can you please tell me how many fingers I'm holding up?
2. 1.
Okay, let's go ahead and switch. Same thing, how many fingers?
2. 1.
Okay. ahead and uncover. And now go ahead and follow the light with your eyes only. Don't move your head. Okay. A little bit of a rapid movement, but I would say nothing out of the ordinary. Okay. Any pain when you're moving your vision?
A little.
A little. Okay. I'm going to go ahead and check your optic nerve. So I'm gonna have you look behind me straight at the wall. Just gonna come very close and shine a light in your eye. A little bit of inflammation in the back of the retina. That might put some constriction on the nerve and block blood flow. Let's check the other side. Okay, so go ahead and look same. Your right side looks a little bit better. Less inflammation. Just a little bit of a retinal scratch. But that could be related to age as well. Let's go ahead and listen to your lungs and heart. This is gonna feel a little bit cold. I'm gonna have you take a deep breath in, okay? And breathe out. One more time, breathe in. Breathe out. And again, breathe in. And exhale. I'm going to listen to your heart. You can go ahead and breathe normal. I can hear only S1 and S2. No S3, no S4. Go ahead and switch with the bell. I'm going to have you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. I'm going to have you change into this gown, and I'm going to start with the back to do a back examination. Also, make sure that there is nothing neuromuscular happening. So we're going to do a very good spine checkup for you, okay? I'm going to put gloves on first. Then I'm going to put your hair up so that I can take a look at your back. swelling on the left side. Okay. Good to start with cervical. I'm going to feel just 2 fingers. I'm going to try to examine C1 and C2. Looking for swelling, signs of inflammation. Very normal curvature at the cervical junction. I'm not feeling any nodules. But I would say thoracic, it is slightly forward. Going to take some measurements and see if there's any asymmetry. A slight protrusion on the right side at the scapular angle. Gonna feel a slight pinching, just looking for asymmetry. A slight inflammation on the right upper side at T3 and T4. Slight redness, a little bit of decreased circulation in that area. I'm going to listen to your back. I'm going to have you take deep breaths in for me, okay? Every time you feel the stethoscope. Okay, breathe in, breathe out. Again, breathe in, breathe Breathe normal. Just going to listen to your spine. We're looking for microscopic friction rubs that could indicate a lack of circulation in the area. I'm going to do a neurological assessment. You're going to feel light tapping and for any changes in movement. Looks normal. Good to go ahead and check your sensations on your back. Please tell me if you feel this on the left or right.
Left. Right. Right. Left. Right. Right. Left. Right. Left. Right. Right.
Okay. Does this feel cold or warm?
Cold. Cold. Warm. Cold. Warm. 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 Cold. 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 Warm. Warm. Cold. Warm. Warm. Cold.
I'm going to touch you with 2 or 1 pressure points. Go ahead and tell me if you feel this 2 or 1.
1. 1. 2. 2. 1. 1. 1. 2. 2. 2. 1. 1. 1. 2. 1. 1. 1. 1. 2.
Do you feel this 2 or 1 or 3 taps?
3. 3. 1. 1. 2. 2. 1, 2, 2, 2, 1, 1. Okay. I'm just going to go ahead and palpate this area. Seems like we did find out what it is and where exactly it originates from. This plexus is definitely known for causing numbness, especially in the arms. Okay, I think I can have you laid down now. Okay, to palpate your lymph nodes, starting with preauricular. Not feeling anything swollen. This could be a salivary gland stone. Beating trachea to check if it's midline. And the thyroid gland is not palpable, not feeling any nodules, not seeing any redness. Going to palpate right above the clavicles. Checking sinuses. And right under your eyes. There's a little bit of inflammation on the pair of sinuses that are lateral to the nasal septum. Just palpating the hairline. There's normal hair distribution. Say normal scalp movement. Doesn't seem to be any vascular constriction. Normal movement. Okay, I'm going to do a scalp
Checkup. There's a little bit of redness more towards the middle of the crown. I'm already noticing some flakiness, but the redness is not localized, so it could be from sun exposure. Go ahead and tell me if you feel this on the left or right of your part. Left. Right. Right. Left. Left. Right. Right. Left. 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 Right. Does this feel cold or warm? Warm. Warm. Cold. Cold. Warm. Cold. Cold. Go ahead and lift your head. Okay. I'm going to do the same thing on the left side of your scalp. Does this feel cold or warm? Cold. Warm. Warm. Cold. Cold. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. This is what dull is going to feel like. Go ahead and tell me if you feel this sharp or dull. Sharp. Sharp. Dull. Dull. Okay. I'm going to check the other side. Take a sample here from this side. A little bit of dryness and dandruff, which is really good because we're going to be able to get a good sample. Very good movement on the scalp, I would say. focus on that lamp. Okay, just light palpation. I'm looking for asymmetry. And any bumps on the skin. I'm going to check your smell. So we're going to do an olfactory nerve test. Go ahead and take a deep breath in through your nose and out through your mouth. And what does that smell like for you?
It smells fresh.
Okay. One more time. What about that one?
It smells floral.
Okay. What about that one?
It smells like cinnamon.
Okay. Let's try one more.
It smells like pine.
Okay. So I would say there's nothing neurologically going on with your nerves. I'm going to go ahead and check your abdomen and then check your legs and reflexes. I'm going to check for any swelling on the abdomen. Okay, there doesn't seem to be any edema. I'm going to listen to your abdomen first. This is going to feel a little bit cold. Checking the lower left quadrant first. Have you noticed any abdominal pain?
No.
Normal bowel sounds.
I'm going to percuss. Let me know if you feel any pain. Okay, I'm just going to slowly and gently palpate, starting with the right lower quadrant. Just checking size of major organs. That's very normal. Checking to see if there is any separation in between the abdominal walls. That's definitely extremely rare in your age group. Okay. Checking kidneys. Going to go ahead and check your legs. Just going to slowly palpate, see if there is any swelling. There's a little bit of swelling, I would say, and we definitely need to minimize salt and elevate the legs whenever possible. That's going to prevent from the blood to not stagnate in the lower part of the body. Just going to slowly palpate. I'm going to check your reflexes. So the right leg, I'm going to bend it over the left one. Perfect. Relax. Okay. Same thing on the other side. Just go ahead and bend this a little bit more. Perfect. Okay, relax. I'm going to check your Babinski reflex. Okay, just relax your foot. Good. Good. So I'm not noticing any flare-ups. Go ahead and push with your pads towards me. No, leave your feet down. Just push towards me. Push, push. Okay, perfect. And now go ahead and pull your feet towards you. Okay, a little bit stronger on the left side. Okay, that's good. I'm gonna try to open your legs. Don't let me do that, okay? Okay, I'm gonna try to close them. Don't let me do that. Okay, I'm gonna have you flare up your toes like that. Okay, now go ahead and wrap your toes around my finger. Okay, a little bit of diminished on the left side there. Can you please tell me if I'm moving your toe towards you or towards me?
Towards me. Towards you. Towards me. Towards you.
Okay, everything looks good. I'm gonna have you sit up and we'll talk about results.
Okay. So we're gonna run some blood work to make sure that everything looks good. But I did not notice anything neurologically happening, and your physical looks very healthy. I'm gonna have you come back in about 2 weeks. If your symptoms do not resolve, we're definitely gonna go ahead and run more tests. But let's see what the blood work shows for now, okay? I'm just gonna make some checks here in your chart. Do you have any questions? Would you like to run more tests?
No, I think you answered all my questions.
Okay, perfect. Thank you so much, Skylar, for coming in, and I'll see you back in 2 weeks, okay?
Great, thank you.
Are you taking any medicine on a daily basis?
Yes, my skin has been acting up, so I take spironolactone and birth control.
Do you know how many milligrams of that?
I actually don't off the top of my head.
Is that once a day?
For both of them.
Okay, do you have any history of high blood pressure?
Yeah, on my dad's side.
Do you smoke or drink alcohol?
I drink alcohol here and there, but just like weekends, if even.
Okay. Any injuries in the last 5 years?
My knees, I started running recently and my knees hurt here and there, but no like crazy injuries. Yeah, no.
Any hospitalizations in the last couple of years?
Mm.
Okay. We are going to start with vital signs. I'm going to take your heart rate and temperature.
Okay.
Have you noticed any flu-like symptoms in the last 2 weeks?
Nope.
Okay. And your blood pressure, we want to keep that under control. Okay, I'm going to take your temperature. .8. This is going to go on your index finger. Just gonna have you relax your finger. Okay, we're going to take your blood pressure. Okay, go ahead and relax your arm. Okay, go ahead and relax.
pressure is 125/60. Heart rate is 79, oxygenation 98% in the room air. That's very normal. Okay, I'm just gonna take this off. And I'm going to take a look inside your mouth just to see if you have any tonsil inflammation.
Okay.
Go ahead and say, Okay, very good. Tongue looks symmetric and normal color. I'm going to put a drop of this on your tongue. Go ahead and tell me what it tastes like, okay?
I'm getting like lemony.
Okay. So this was coconut oil.
Oh.
Okay. Go ahead and look up for me, please. Okay, I'm not seeing any inflammation. I'm just going to go ahead and touch your nose. You do have a little bit of a deviated septum. Any injuries to the face?
No.
Okay. Go ahead and breathe in, breathe out. And again, breathe in, breathe out. Okay. Can you go ahead and tell me to which side I'm moving your nose, left or right?
To the right. Left. Up. Down.
Keep your eyes closed for me. I'm going to cover one nostril. Go ahead and tell me what this smells like.
Like tea tree, eucalyptus.
Okay. Let's go ahead and check the other side. I didn't notice anything abnormal with your left side.
Lavender.
Okay, very good. So only your taste is a little bit obstructed.
Yeah, that's weird.
I'm going to touch you on your face. Go ahead and tell me if you feel this on the left or right.
Left. Right. Both. Left. Right.
Okay. Do you feel this equally on both sides?
Mm-hmm.
What about now?
Yes.
Okay, go ahead and lift your eyebrows up for me. I'm going to try to push them down. Don't let me do that. Okay, very good. Relax. I'm going to have you puff your cheeks and keep them puffed for me. Don't let me unpuff them. Very good. Relax. With your eyes closed, go ahead and give me a big smile. Okay, and frown with your eyebrows. Okay, very good. Relax. With your eyes closed, I'm going to go ahead and tilt your head to the right. Don't let me do that. Let's do that on the other side as well. Don't let me do that. Okay, now go ahead and try to touch your chest with your chin. Good, relax. I'm going to put my hands on your shoulders. I'm going to have you shrug your shoulders for me when I tell you, okay? Go ahead and shrug. Very good, relax. Now go ahead and lift your arms up. Go ahead and squeeze. Squeeze hard. Very good, relax. With your eyes closed, go ahead and put your arms in front of you like this. Okay. I'm gonna try to open your arms. Don't let me do that. gonna try to close them. Don't let me do that. I'm gonna try to push them down. Don't let me do that. I'm gonna try to push them up. Okay, go ahead and relax. I'm going to check your reflexes. Go ahead and relax your jaw a little bit more. Kind of like open it. Okay, perfect. Good. Okay, go ahead and relax your arm. Good. Okay, perfect. Okay, Ms. Johnson, I'm going to go ahead and listen to your heart first. I can hear only S1 and S2. No S3 or S4. I'm going to check for murmurs. Go ahead and breathe normal. I'm going to have you take a deep breath in and hold it for 3 seconds. 1, 2, 3. Breathe out. Okay, very good. And to check your lungs, take a deep breath in and exhale. And again, take a deep breath in. I'm going to listen to your sides. Go ahead and relax. You can relax this arm. Just gonna listen here. Take a deep breath in and exhale. Okay. And this side, take a deep breath in and exhale. So I do want to listen to your back as well. I'm going to have you face that wall. I'm going to listen to your back. Go ahead and take a deep breath in and exhale. One more time. Breathe in. Breathe in, breathe out, and again, breathe in, breathe out. Okay, you can go ahead and breathe normal. I'm just gonna slide the stethoscope a little bit under your shirt. Go ahead and take a deep breath in and breathe out. One more time. Breathe in. Breathe out. Okay, I'm going to go ahead and examine your back. Go ahead and relax your neck. Taking a spine and shoulder measurement, checking for asymmetry. Okay, looks good. So what I'm gonna do now is I'll have you lay down. Okay, kindly, I'm going to first palpate your face muscles, feeling for any tension. And as I'm doing this, I'm going to check your sinuses as well. See if there is any fluid buildup. Slowly pulsating around the eyes. I'm not noticing any puffiness or asymmetry, but I'm going to take some measurements. Go ahead and lift your head up for me. I'm going to take your head circumference. Relax. Go ahead and lift it up. Relax. I'm going to measure the anterior shoulder area. 38.
clavicles from the auriculum to the sternum. I'm going to check your lymph nodes, starting with the post-auricular. Just using a circular motion to see if there's anything palpable. Moving down to the trachea. Trachea is the midline. And the thyroid gland is non-enlarged. I'm not feeling any nodules. Go ahead and swallow for me once. Just going to palpate above the clavicles. Can you go ahead and shrug your shoulders a little bit? Okay. And relax. Go ahead and tell me if you feel this on the left or right.
Left. 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 Right. Right. Right.
Okay, I'm going to touch you with two textures. One, it's going to feel sharp. This is what the sharp is going to feel like. Can you go ahead and confirm?
Sharp. Sharp.
Good. And this is what dull is going to feel like.
Okay. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp.
Let's take a look at your scalp. I'm going to look for any bumps, lumps, alopecia, any signs of hair thinning.
Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. Sharp.
Does that feel sharp or dull?
Can you do it again, please? Dull. 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 Sharp. Sharp.
I'm not noticing any signs of hair loss. The scalp skin looks very normal. There's no redness, no signs of inflammation. No tightness around the skin or the hair follicle. I'm not feeling any lumps on the skin. Very normal movement. Okay. Let's go ahead and take a look at your abdomen.
I'm going to listen first to the left quadrant. Very normal sounds. Good. discuss. Normal percussion sounds. I'm going to go ahead and start palpating first on the right upper quadrant. I'm looking to see if there is any inflammation around the liver. Moving to the left upper quadrant. Using a deep palpation to check for any abnormality. Checking for any separation of the abdominal walls. Go ahead and check your reflexes and mobility. Okay, so I'm just going to go ahead and check for any edema. Okay, I'm going to palpate pedal pulses. Okay, go ahead and wiggle your toes for me. Okay, perfect. I'm just going to take a look in between toes. Sometimes there can be a little bit of irritation, dry skin. Okay, I'm going to check your reflexes
Go ahead and relax from the knee down. Just going to guide your foot. Good. Go ahead and relax your foot. Good. Going to check your Babinski reflex. Good. No flaring. Perfect. Go ahead and tell me when you don't feel the vibration anymore.
I don't feel it. Stopped.
Go ahead and tell me if you feel this pressure or vibration.
Mm-hmm.
Pressure or vibration.
Vibration.
And now.
Pressure.
And now.
Vibration. Vibration.
Okay, perfect. Go ahead and tell me if you feel this towards you or towards the floor.
Floor. Me. Floor. Me.
Okay, perfect. All right, I'm gonna have you sit back up. I'm just going to take my clothes off, and everything looks very good. Kylie, I'm going to recommend that you do get a vision check since we weren't really able to do that here. And I do know that you're wearing contacts, right?
Mm-hmm.
So when was the last time you got an ophthalmology checkup?
I would say maybe around this time last year, so I am due.
Okay. Have you noticed that your vision changed or that it's difficult to see with the contacts?
No, I've always had bad vision, so yeah, nothing's changed.
Okay.
They
That's
just
good.
are still bad.
Well, we can go ahead and recommend a very good doctor.
Great.
And have you considered having eye surgery to correct vision?
Yeah, probably LASIK a little later in my life. But yeah,
Okay.
still thinking about it.
Yeah, you're at the perfect age, and I think after a proper exam, we can definitely tell you if you're a good candidate or not.
Sure. Yeah, like that.
Thank you so much for coming in.
Thank you.
Pressure. Hi, Nicole.
Hi.
My name is Dr. Matt. I'm going to do your chiropractic adjustment today. But first, I would really need to have a little bit of history to make sure that we know which part of the back is hurting you and if there is any immobility problems that we will address those. Do you have any history of car accidents, bike accidents, or anything like that?
I got in a car accident about 6 months ago.
Okay. And were you having any issues before that?
I've always had a little bit of back issues, but I've had more since the car accident.
Okay. And have you had any injuries to the spine, neck, or head?
It was a head injury.
Okay. Did you lose consciousness?
No.
Okay. And how fast was the recovery?
I recovered in about a month or so, 2 months.
Okay. Have you had any issues with walking after that?
No.
Okay. Any issues with moving your arms, your hands?
Just when I move my shoulders, I can feel a lot of tension in my neck and my upper back, and it can get a bit painful.
Okay. Do you like to sleep on the side, on the back, or on the belly?
I sleep on my side.
On the side. Okay. Is there a preference that you have?
I move around a lot.
Okay. then what I can do is take a look at your gait, and then we're going to do a detailed assessment to see exactly where the immobility is. And then we're going to go ahead and do a plan so that we treat you today as well.
Sounds good. Thank you.
You're welcome. I'll have you stand up now. Okay, so go ahead and take a few steps. Just walk normally. I'm just taking a look at the gait. Keep on walking. Very good. A little bit of pronation on the right side. Your right foot is going. Keep on walking towards me, and then I'll have you turn around so that I can take a look at the back. Stop. Okay. All right. Is it okay if I palpate on the right side and the left side of the hip? Just taking a look here to see if there is any misalignment. Okay, your right hip is also moving a little bit forward, and that could definitely cause that misalignment in the spine. Any pain as I'm palpating on the right side?
No.
Okay, just going to check here the lumbar area and how it adjusts with the hip. Just feeling to see if there are any nodules or anything swollen that could be putting some pressure. Okay. Just going to keep on pressing here. With your right foot, go ahead and push it in like this in front. Any pain there?
Mm-mm.
Okay. Any pain as you're pushing down now?
No.
Okay. Let's go ahead and do the same thing on the left side. Any pain here?
No.
Okay. Now go ahead and try to touch the outside part of your knee with your left hand. Any pain there?
No.
Okay. Come back to center. We'll do the same thing on the right side. Okay. Left side is also a little bit tight here. We can definitely do an adjustment and see how that feels after. Okay, moving up to the spine. Okay, just going to put your hair here on the side, and just gonna feel my hands sliding on their left and right, looking for asymmetry and changes in temperature. I usually like to check this twice because it definitely gives a good understanding of the neuromuscular balance. Okay. Palpating scapula to see if there is any misalignment or immobility. Any pain here?
Mm-mm.
Okay. Any pain on the right side?
No.
Okay. And your pain is mostly upper, correct?
Mm-hmm.
Okay. Okay, so I'm gonna have you sit on the table facing the wall, and I'll take a look at the upper back.
Okay.
Just going to slowly palpate, starting with cervical spine. Go ahead and look level, parallel with the wall, just trying to see if there is any abnormal curvature. And if I'm noticing any changes in symmetry. Looking for abnormal reflexes. Again, we're looking at the neuromuscular mechanism and how we can balance the nerve induction. Okay, slight movement at T2, T3. Okay, only on the left side. Okay, just listen to your spine. Just gonna have you, as I'm doing this, I'm gonna have you touch your chest with your chin. So slowly move down and then slowly move back up. Perfect. Okay, let's go ahead and do that again. Trying to see if there's any microscopic sounds that we can pick up with the stethoscope. I think there is a little bit of scratching that I can hear. And it was mainly here, the same point where it noticed the neurological impulses. Just going to listen to the sides. You can go ahead and relax your neck. Okay, go ahead and tell me if you feel this pressure or vibration.
Vibration. Pressure. 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 Vibration. Pressure. 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 Vibration. Vibration.
Okay. So this is the second assessment that I'm doing to check for any neuromuscular imbalance. We're looking for deviations in temperature around the spine and at the spine level. Slight temperature at T1. Just going to mark the points that I will be focusing on and slowly move down. So these three vertebrae right here, definitely we need to create some alignment and increase spine mobility. That's going to help for the fluid to be released and for the inflammation to subside. There's a lot of inflammation here on the thoracic area. So it does look like it stops at the last thoracic. I'm gonna have you lay down and I'm going to start with a neck adjustment first. Okay, go ahead and relax. And I'll start by palpating your neck. There's a lot of tension here in the back. We do need to soften the tissue before we do any adjustment. The benefits are definitely 10 times more when we do that. I'm going to apply an anti-inflammatory oil so that we can apply cold therapy and decrease some of that inflammation here. It's going to feel a little bit warm, and in combination with the cold therapy, it's definitely going to bring down some of that fluid buildup and tension that has been building up around the vertebrae. This is going to feel a little bit cold. I'm just going to have you turn your head towards your right. Perfect. Just going to massage the carotid artery, moving to the sternocleidomastoid muscle. So we're just softening the fascia that connects from the lower part of your scalp with the neck. Moving to the other side, I'm just going to have you move your head that way. Perfect. And this is going to feel a little bit cold. Okay, I'm gonna have you relax your head in my palms. Just going to kind of like do a wiggle test to see the movement. Okay, go ahead and take a deep breath in and breathe out. Good. And one more time. Very good. I'm going to switch to the arms. Just going to slowly apply gentle pressure. I'm going to use warm therapy here to soften the joints. Okay. These are warm medicine balls that help to release tension and decrease muscle tension in the shoulder joints. The muscles also relax. Go ahead and relax your arm. Just going to apply pressure here on the main points so that we release tension in the cervical and thoracic area. Take a deep breath in, breathe out. Very good. Just going to go ahead and release tension from the finger joints as well. This helps with collagen production. It really increases that joint mobility. Just finding the pressure here, the point that we need to release. Go ahead and take a deep breath in and breathe out. Perfect. Okay. Go ahead and relax your knee. Just going to see how the alignment is here on the right side of your body versus left. Okay, that's good. Doesn't seem to be overly pronated, but your right hip is definitely a little bit elevated. And looking at the malleolus, it's definitely more increased on the right side than left. So what we could do is to increase that joint space so that we allow for collagen production to be slowly released. Very good. We're gonna go ahead and have you flip over on your belly. Kind of go just slowly pressing down at the lumbar region to see if there's any imbalance in the neuromuscular plexus. We're looking at the whole spine. The first micro alignment that I want to do is right at these points where we noticed a change in the neurological temperature. This is considered a microalignment. Go ahead and take a deep breath in, breathe out. Good. How does that feel?
That feels good.
Okay. Okay. Going to apply an anti-inflammatory oil. It does help to release that tension and bring down inflammation. Going to be focusing on the middle part to slowly release. How is the pain?
It feels good.
Okay. It's going to feel a little bit cold, just applying pressure. Are you more tense on the right side than left?
Mm-hmm.
going to use cupping to increase circulation. Okay, just going to do a slow adjustment here at the heel. Since I did notice that you're having a little bit of pronation with the right foot. Just going to use gentle cupping to stimulate blood flow. It's going to feel like a gentle pressure. This helps to distribute blood flow evenly.
Sharp, dull.
Hi, Skylar. Thanks for coming in. So today we're going to do a chiropractic adjustment, and you've been having some back pain.
Mm-hmm.
Where exactly is it located?
On my lower back.
Lower back. And do you have any shoulder pain? Any limited positions?
Yes, my shoulders.
Okay. Are you able to have full range of motion?
It's pretty full range, yes.
Okay. A little bit about your history. Do you have any hypertension in your family?
Yes.
Okay. Any brain injury?
No.
Okay. Have you had any spine surgeries?
No.
Okay. Any neck, shoulder, or knee replacement?
No.
Okay. And are you taking any medicine on a daily basis?
No.
Have you had an x-ray before?
Yes.
Okay. So you definitely want to take an x-ray today and see exactly what we're dealing with. But I'm going to try to do an adjustment and see if that helps with your pain. First, we need to assess and check exactly what it is that you're dealing with. I'm going to do a few tests. We're going to measure the range of motion and if there is any hyper or hypomobility in the spine. Okay? Let's go ahead and have you face the wall. I'm going to take a look at your back and shoulders first.
Okay.
A bit of fresh pair of gloves, and I'll start by assessing your back. Going to put your hair up. Okay, so immediately we're noticing that there is a little bit of inflammation on the right side. I'm looking for symmetry and elevations in muscle groups that are tied to the spine. Okay. I'm going to check, see if there's any temperature variations. Here is definitely a little bit warmer. Are you feeling any pain along the spine?
A little.
Okay. So go ahead and tell me when you don't feel the pain anymore.
Now.
Okay, so it starts from the middle. So that's about C, the T3. But a lot of the pain that originates from the mid point back actually is sent through the plexus from the cervical spine. So there are a few points here in the back that we can definitely adjust so that we are targeting these good muscles. Okay. Alright, I'm going to press down on the same point where you experienced more pain. I'm going to have you lift your arm in a 90-degree angle with your body and stop right there. Okay. Now go ahead and slowly move it above your head and stop right there. You can bring it back. So we'll do the same thing on the left side. So first do a 90-degree angle. Okay. Now go ahead and slowly put it above your head and stop right there. You can bring it back to center. I'm going to check your scapula. Since the right side does seem to be inwardly inverted, I'm going to check this side first and see exactly what we're dealing with. Checking for immobility. So I'm going to do a few tests here. First, I'm going to have you kind of go over your chest and touch your left shoulder only with your left hand. Relax the other arm. Okay. Alright, I'm going to have you come back to center with this arm. Okay, so it already moved, which is great. Let's go ahead and do that one more time. Okay, come back to center. Okay. So hold the same thing on this side. First, I'm just going to palpate without any movement so that we can compare sides. Okay. So with your left hand, go ahead and touch your right shoulder. That was good movement there. Okay. That. And come back to center. Any pain as I'm pressing down here?
Yes.
Okay. So that's definitely the part that's limiting the mobility at the thoracic region. Okay, so now we're going to do the same thing. I'm just going to make a slight adjustment here. Okay, so I'm going to try to do the same thing. Touch your right shoulder. Any pain here?
Yes.
Okay. You can come back to center. Just going to do another adjustment. See if that helps.
I'm gonna have you do the same thing slowly. Any pain as I'm pressing down here?
No.
Okay, that's perfect. Okay, I'm gonna have you first lay down. We're gonna take a look at your shoulders and your back. I'm softening the muscles. Just going to unclip your hair. I'm going to do skin pulling first. This helps to increase circulation in the area that we're trying to adjust. Okay. Where was your I'm going to do a neurological test. It's going to help to determine if there is any inflammation in this area. So we're going to do some measurements, starting from the last cervical. Okay, slight variation at T3. Just gonna go ahead and mark that. Okay, it's about 10-degree change at T4. Okay, there's a lot of inflammation in this area for you. And the closer we get to the point where you indicate you have more pain, it's definitely getting more frequent. I see normally these fluctuations in spine surgery patients. Okay, so it does slow down as we're moving past that point, which is a good sign. Going to do an adjustment here. apply these points to minimize any immobility. I'm going to have you take a full deep breath in and breathe out. I will do that one more time. Breathe in, breathe out. Okay. Just going to go ahead and take off the necklace. I'll just put it on this side so we can take a look at your neck. Okay. There's a lot of fibrous tissue in this area. We do need to soften these muscles before we do any adjustments. I'm going to apply an anti-inflammatory oil. Pain as I'm doing this. I'm so sorry. This is going to help to soften the tissue and make the transition a lot easier.
I'm going to do a little bit of hair pulling. This helps to release some of that tension that you accumulated in this cervical region. Hair pulling does help with inflammation and reduce swelling. Okay, moving up to the crown. Do a little bit of lymphatic work. So we're going to focus on the lymph that is in the neck and shoulder region. I'm going to lower the straps from the shirt. Perfect. I'm going to apply an anti-inflammatory oil. So we want to move the lymph up. We're using very gentle strokes. do a few testing here. Go ahead and tell me if you feel less sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Sharp.
I'm going to listen to your spine. We're looking for abnormal microscopic sounds.
Going to move to the shoulder area. Okay, very little movement here as compared with the center. Looking for increased inflammation, swelling. You want to make sure that in today's treatment we are assessing the physical part of the spine. Little movement along the spine. That's something that we definitely are happy to see. This is going to feel a little bit cold. Following pressure point therapy, using a little bit of cryotherapy to tackle the inflammatory markers. as well. Just going to go in a little bit deeper and decrease inflammation in the cervical region. To use cupping therapy to release blood flow